And more than 7 children out of every 1,000 will not live to see their first birthdays. That's one of the highest rates of infant mortality in the nation. Here in St. Joseph County, the problem's even worse. At 2014 rates, more than 8 children will die before turning 1. This is a problem that health officials have been trying to solve for quite some time now. WSBT-22's Patrick Roth has been looking into this, and he joins us now with more here. Patrick, when you put these numbers into perspective, these rates are just incredibly high.
Yeah, Jennifer, St. Joseph County has a higher infant mortality rate than places like Ukraine, Lebanon, and Latvia. And in the African-American community, it's even higher. But health officials here think a $50,000 grant from the state health department could go a long way towards solving this problem. The national average for infant mortality is 6.17 per 1,000 children, meaning out of every 1,000 children born in the United States, more than 6 will die before they turn 1. And Indiana has one of the worst rates of infant mortality in the country, and the rate is even worse in St. Joseph County.
They're not particularly good. Last year, 2014, I think we ended up at 8.5 per 1,000.
It's even higher in African-American communities, where the rate is closer to 14.5.
It's a number that resembles developing countries. And so that is startling. It's been that way since I began this position.
Health officials have had some success in bringing the rate down in the past. In 2011, it was only 4.2, more than half of what it is now. But doctors say there are some factors that have contributed to its rise.
One is smoking. There's a tremendous number of smokers and our pregnant women.
We can see where the safe sleep issue is very high with a lack of adequate sleeping arrangements or even proper sleeping techniques.
The hope is that by applying for the Fetal Infant Mortality Review Program, or FEMR, it'll give health officials a better idea of what exactly is causing so many infant deaths. Then they can have better education programs to teach new parents ways that can keep their babies safe.
Hopefully we look at it from the medical side, the community education side, you know, both grassroots and grassroots tops, that we can get a grasp of what's happening so we can eliminate this disparity and eliminate this issue.
Now, the hope is that with better understanding of the causes of these deaths, officials can have a more effective outreach and education programs. Last year, 26 babies died before they were 1. 7 of those deaths were preventable. And it's with easy measures, such as making sure a baby's sleeping on its back, not on its stomach, that can prevent those deaths. Live in the studio, Patrick Roth, WSBT 22 News.